Let me just say, first, happy holidays. In 2017, we lost about 50,000 individuals across the United States to opioid addiction, overdosing. And just in Baltimore City alone, we lost some 761 people. Back in April, we announced this level of care initiative, working with our hospitals throughout the city. And we're so grateful that many of them have come to the table to say, once again, they want to work with us, and this is important. The leadership at the hospital level is important in terms of this entire initiative. And so I wanted to announce where we are with this level of care initiative, and so I'm going to have our acting commissioner of health, Mary Beth Howler, speak more about that, and then we'll say more about the hospitals who stepped up to the plate.
Thank you, Madam Mayor.
And I want to thank our Comptroller, Joan Pratt, for joining us.
Good morning. Thank you for being here. And thank you, Mayor Pugh, for your vision and leadership and unwavering support of the Levels of Care initiative. I want to thank our 11 hospital partners who have joined us today, as well as our technical consultants and members of the health department's team. This past April, the mayor and Baltimore City Health Department announced the levels of care for Baltimore City hospitals responding to the opioid epidemic. The levels of care employ evidence-based best practices for treating addiction and preventing overdose. 16 practices were developed with active input from our hospitals and the community. They include screening hospital patients for addiction, offering treatment on demand for those who screen positive, helping patients at risk for overdose to get naloxone, and making sure that their doctors are prescribing opioids judiciously so that we can end the cycle of addiction and overdose deaths. There are 3 levels of care. The higher the level, the more comprehensive a hospital's response, with level 1 being the highest, then level 2 and 3. But all levels recognize that treating addiction must be done in the same way as any other disease if the epidemic is to be curtailed. Today, I am happy to announce with the mayor that all 11 participating hospitals here in Baltimore City have received certification. This formalizes their commitment in addressing the opioid epidemic. Each hospital presented innovative initiatives that can also serve as models nationally. For example, MedStar Hospital System provided training and waived dozens of their providers to increase their hospital's capacity to start addiction treatment. Johns Hopkins has worked to decrease opioid analgesic prescribing rates using their electronic medical record. University of Maryland has instituted a Meds to Beds program that delivers naloxone directly to patients with an opioid use disorder before they are discharged from the hospital. Moving forward, each hospital will be eligible to apply for a higher level as they continue to improve their ability to respond to the opioid epidemic. We know that people with opioid use disorder move through our city's hospitals every year, and the services that hospitals do or do not provide to these patients have a significant effect on their morbidity and mortality. Today, thanks to Mayor Pugh's leadership and the commitment of our city's hospitals, we are bringing much needed innovative models of care to our residents. Thank you.
We
don't have a list.
So I didn't know whether anybody from the hospital community wanted to speak, or if you had any questions. Any questions?
Yeah, now that these hospitals have been certified, what's the next step?
Hi, good morning. My name is Dr. Shelley Chu. I'm the Senior Medical Advisor at the Baltimore City Health Department. First, I just want to say that we are so excited that all the hospitals have committed to the levels of certification, and to even get to this point has required a tremendous amount of resources and dedication. And this is the beginning of a journey. I know many hospitals have already set out a plan of even achieving the next level as well.
Is the health department going to be inspecting or regulating to make sure that they actually do the things they say they need to have that happen?
We're in constant communications with the hospitals for this process. The hospital submitted a self-application, a self-assessment, and they also submitted an application with documents supporting their activities and their protocols as well. And we've been in constant communications with the hospitals, and moving forward, we will still continue to do so.
How much funding is involved?
So for this, the hospitals have, this just shows how much tremendous dedication and resources they have committed, because the hospitals have invested their own resources into this.
Is every hospital in the city participating in this?
So all 11 hospitals, which we made an announcement and during April 30th, have participated in this Levels of Care initiative.
Is that's every hospital in the city?
There are additional hospitals, so there are specialty hospitals such as the Children's Hospital in Mount Washington as well, but with 11 acute care hospitals, we've been working with them closely.
Yes.
I have a question for somebody in the hospital community.
Okay.
I don't know if you know this number, but just kind of give us an idea of the number of people who come through your emergency room on a day or a week. How many of them have substance abuse issues that really need immediate attention?
It's a really good question. Good morning. I'm Allison Brown, president of the University of Maryland Medical Center Midtown Campus, and we are very proud to have been designated as level 1 at both our downtown and Midtown campuses. Your question specifically at the University of Maryland Medical Center Midtown Campus, approximately 70% of the patients who we see in our emergency room have either a behavioral health and or a substance abuse diagnosis. So it's very prevalent in the community that we serve, and we consider it our mission, and we're very proud to do so.
Is that atypical, or is that?
It's similar to the downtown campus. Others who could add in?
Anybody from MedStar?
Good morning, Stuart Levine, the president at MedStar Harbor Hospital. I don't know the exact percentage, but like Allison said, it is extremely high in our emergency department. At MedStar over the last several years with the universal screening protocol in our emergency department, we've screened nearly 500,000 patients across our three Baltimore hospitals and one of our county hospitals. Of that, we've referred over 2,700 patients to treatment, and these were patients who were not necessarily presenting for an opioid-related initial complaint. And so the numbers are quite staggering in terms of the prevalence of opioid use disorder in Baltimore and in our region. And it's programs like these programs that are enabling us to identify the problem, provide treatment on demand as a component, and then refer patients to community-based resources and other treatment programs and facilities. So a tremendous program. And one of the other key components is that we employ community-based health workers and peer recovery coaches that enable us to make these peer supports possible. So all around, as Allison said, we're tremendously proud to be a part of this. It is absolutely consistent with our mission and something that we just absolutely need to do as city health providers.
Someone mentioned some of these policies might be able to be spread nationally. How would you begin that conversation?
Even for this Levels of Care initiative, it was actually taken from Rhode Island, where they implemented something similar on the statewide level. And as we expand with the Levels of Care initiative, I think we want to share all these best practices, such as the stories that you've already heard from our interim health commissioner as well, so that all the hospitals in the nation can learn from what Baltimore City hospitals are doing.
Anybody from Hopkins want to say anything? Okay, all right. Any other hospital? All right.
Hi.
Okay.
Melissa Richardson from Johns Hopkins, and our experience is exactly the same as what you've heard. The numbers are staggering, both in the ED and with patients that are admitted for other problems as well. Very prevalent.
Has it changed over time as well, or has this always been?
It's just getting worse. Thank you.
What's your, from the work you do and what you see, why is it getting worse?
I would say that's because of the epidemic that's surrounding our city, our state.
So we know opioid addiction is a problem throughout the state, and one of the conversations I've had with our regional partners is how we work together on solving this problem. And I think the hospital level is one level, but it is not just a problem in Baltimore City, and many of us see people traveling from jurisdiction to jurisdiction, from state to state. And so it is how we work together. In fact, I've had conversations with the new county executive in Anne Arundel County, who's looking at Crownsville and saying, he's willing to take this on, in terms of drug treatment and creating a facility where you can not just get treatment, but job training and other things, but it will be a regional effort in how we all work together. But the hospitals being a part of this is essential because so many people come through their doors, and where we send these individuals, we're starting a stabilization center. It'll be one of the first in the country, but this is really a beginning. And then how are we using new technology to treat those who have drug addiction issues? I think all of these things have to be examined. When you think about the amount of money that's being spent on treatment, the question we should be asking ourselves is, are we spending it appropriately? And are the people who really need the help getting the help? And I think the hospital system is one way to deal with that. But again, we find people who suffer from homelessness, mental illness, all of these things play a role in our society of individuals who are involved in drug addiction and those kinds of things. So I'm grateful to the hospital system for taking this on because, as has already been pointed out, many of our emergency rooms are being crowded with individuals who have drug addiction issues. To now have a protocol for dealing with that, I think bodes well for how we move forward. I agree with you. I think we have to figure out how do we do this in a better way that really gets the treatment down to the people, that we're not sending money down dark holes. Any other questions? Thank you all. Thank you. Thank you for your partnership. Where's the control? Today at the Board of Estimates, I want to thank those who've done early stories on the Neighborhood Investment Fund. We announced the Neighborhood Investment Fund, and the Neighborhood Investment Fund, which was approved, the agreement was approved this morning at the Board of Estimates, is an opportunity for us to invest in underinvested neighborhoods that have been underinvested in for decades. And so I'm excited to have our comptroller here, and I also want to take a moment to thank our president and the city council, who early, before I even became mayor of the city, talked about not selling off our garages, and he was right about that. I can tell you that in 1972, when we sold off our airport for $36 million, the thinking was not in place to say, okay, what else could we do that would keep that airport in the hands of Baltimore City? And this is an example of valuing the assets of your city. And I think that's the point that he had made some time ago, and it certainly is a point that I've taken well. We are looking at all of our assets, and I said this early on in this administration. It's the same thing with our water system. We wrote the charter amendment that said that we would not sell our water system because we value our water system. And even though we'll see increases over the next 3 years, what we'll see is decreases following that. But this Neighborhood Investments Fund is an opportunity for us to look at neighborhoods that have not had this kind of investment for decades. When we think of looking at Park Heights, and when we think of East Baltimore and Sandtown and all of these other neighborhoods that have not seen this kind of investment, I think it will bode well for the future of our city. And so I'm excited about that work. And as you well know, just last week we signed an agreement to create the Affordable Housing Trust Fund. That's another $20 million that will go into affordable housing. And a real example of that is just a couple of weeks ago, the gentleman who laid on the corner of Mulberry and Martin Luther King Boulevard for decades was actually burned laying on that corner, ended up at the University of Maryland in shock trauma. He's now in his first apartment in our right there at Ricerstown Road, right across from Mondawmin, the new building, because in that particular development is affordable housing. And on Saturday, I had the opportunity to greet 3 new homeowners in Sandtown because of the work that we're doing with Habitat for Humanity's Chesapeake, who would now have mortgages of $500 a month with no interest because of the work that we're doing. This is the kind of development that will take place and the kind of interest this fund will take in looking at neighborhoods and communities and individuals who need opportunity, but more importantly, what is a neighborhood? What is a community? And part of that is looking at the business establishments that should be feeding into those neighborhoods. You look over there at Linden Avenue, right there off of North Avenue, where we've cleared all of those acres of land in front of a brand new school, Dorothy Heights, where we're trying to get a supermarket, another great opportunity for us to invest. So I'm looking forward to the work that we will do together on this. The $2 million from the $57 million that we were able to net will go into supporting capacity building operations for community associations, and another $3 million will go to capital improvements for our CDCs, and couple that with the $75 million in core money that we anticipate on keeping going in Baltimore that has allowed us to clear land. And you can see it if you've not been up to Park Heights and seen the 60 acres that we've already cleared. I invite you to do so. But again, I want to say thank you for working with us, and thank the President again for recognizing how important our assets are for our city. Okay, and so these are team folks around us. Housing will have a big part in this, and I think they are, but it's okay. A lot of people are afraid, but I want to thank everyone in this room who had a part in making this happen, and so thank you. And so I'll take questions.
Mayor, let's talk about the police issue.
Okay.
Which is
Any questions for, let me just say, any
we
questions for
always
these
talk
folks? Any questions? All right, thank you, everybody.
Thank you.
Mhm.
So you're seeking support from the state on a couple of fronts as it pertains to the police department. So my understanding is that you're looking for $30 million over 2 years to hire more police officers.
Well, let me just say, Jane, there are a couple of things that we need to look at in terms of the police department, and it's not just more police, it's patrol people. But part of that will require us looking at the police department, period. You know, we lost 584 people over the 7-year period before I became mayor. And when you do that, what happens is there's a lot of freezing of hiring. When you freeze hiring, what you create is a top-heavy organization. And so I think we'll have a responsibility, and I've got my Bloomberg team and the Mayor's Office of Criminal Justice and our data people looking at every single position currently in the police department and how many people are serving in each of those positions. I'm talking about at the officer level. And then evaluating what we need to be doing as it relates to the top heaviness of this department, because that's reality. And, you know, oftentimes I'm accused of looking at things from a financial perspective, but I'm also analyzing where we are and how we got there. You know, you can't freeze positions and have people on the ground and think you're helping the department, because the reality is that you're not. And so where we're short are foot patrol. And at some point we need to look at, how many people are in these upper positions and how many people we need to, I guess you would say, look at in terms of how we restructure the police department. And then the 545, and you know, this is a conversation I've had with the finance department, that we can't keep putting 2,800 people on the books when you don't have 2,800 people. And we don't know what the real right number is, and there is a study that talks about, you know, what percentage of your department should be on patrol. And the average across the country is around 60%, 45 being the median, I think 60% being around average of what you want, and based on population. But, you know, those aren't the numbers that we currently have on patrol. I think that this FOP contract that we just signed will make a difference in terms of foot patrol in the future. You know, getting our police officers back to 5 and 2, I think is going to make a difference as well. But training, and training right, and understanding the capacity of your training currently, like currently where we are, our capacity to train is about 240, 250 max. So even if you were training 250 and you're averaging a loss of about 200 now in attrition rate, you still haven't filled the void of the 300 or 400 that you don't have. So how do you get there? Part of that is expanding training, and so that's why we're looking at Coppin State University to expand our training so that we can train at least 300, 350, 400 officers a year over the next 2 to 3 years so that we can get to the number of foot patrol people that we need. We need to bring foot patrol people into the police department because people need to see folks on corners and in communities in our city.
So my question is, if the state gives you money, which Mike Miller is indicating will help you with hiring more officers, et cetera, but there's a finite time on that. Now you've added positions, and so what happens down the road for funding?
Well,
this is already an expensive
no,
department.
but again, it's about looking at the entire department. We need foot patrol people, okay? And so what we'll be bringing in are foot patrol, but you got to look at the whole organization in terms of how many folks are in every position in the police department. So at some point it's retiring folks, it's letting moving some positions. 100 of those positions that we're going to move to civilian positions, so you know you're going to move those out as quickly as you possibly can, civilianizing some of those positions. So I think it's a tremendous undertaking, but it's one that we must do.
But my question is, if the state's going to fund more positions, which is what you're seeking, am I correct? You're seeking $30 million over 2 years. Okay. And so the number is somewhere around 500 officers.
Right.
Correct? That would be new positions in the police department.
That would be new positions. But what he's understanding is that we need patrol people in the police department. So if we get that money from the state, then it behooves us to look at the organization, because I don't think that means increasing the number of patrol. That doesn't mean increasing the number of police officers. That means increasing the number of patrol people on the ground. But does it take what, 1,700 people to manage 5 or 7, or to manage 1,000 people? You know, I think those are all of the things that we have to look at. So how do you fix that? You know, because what I'm trying to do is get people on the ground as quickly as we
So
can.
just to be clear, you're not talking about in the long term creating a bigger police
No,
department.
absolutely not.
You are talking about
Creating more positions in foot patrol, and then looking at the department in terms of the positions that are above, and saying how many of these positions are positions, one, civilianization, positions that could be eliminated.
If you're not looking to create a bigger police department, then why do you need then state money to help? Can't you just shift around money?
Because we need to train now. We need training dollars, we need additional facilities, and all of that.
You used the 60 to 65% of officers on patrol as kind of a national average.
45 to 60%.
What do we have in Baltimore?
I think somewhere around 30.
just a quick question about the D'Souza case.
Yeah.
So it emerged yesterday in his plea agreement that, in Darrell D'Souza's plea agreement, that in December of 2015, which would have been during the Kevin Davis administration, there was a letter called a lock-in letter, which is a standard letter, that was sent from the IRS to the police department that said, he's claiming too many allowances, start withholding more money. So that's a piece of paper that exists somewhere in the police department
Right.
about his tax issues.
Not in the files that we saw.
Not
Absolutely not in the files we saw.
Does the admissions that he made yesterday change your opinion of him? I mean, he wasn't just failing with paperwork, he was lying on his taxes.
Well, let me just say, I'm not responsible for what people do about their personal lives, and some of the allegations or some of the admissions that were made were as surprising to me as to other people, I'm sure, in our community.
I mean, presumably had you known that, you would never have appointed him to be a police commissioner.
I think if we had known that there was information that should have been in a file that was not there, I think we would have had information that we could have asked questions about. There was no information regarding any of this in his files.
Do you have any idea how many lock-in letters have been received by the Baltimore Police Department?
No, I don't. I wonder.
Well, Jamel Rayno apparently did the same thing.
Yeah.
In terms of cheating on deductions, that's not an uncommon practice in this country. But
Well, you know, Jane, the reality is that stuff does not come to light until, you know, the federal government comes after you. And it's unfortunate that those kinds of things happen, and that, you know that we got to pay our taxes, and those are issues that we all face. All of us who are law-abiding and working citizens, we have to pay our taxes.
Your thoughts on the gun buyback program so far?
So far, I don't know where we are today, but over 500 plus, almost 600 guns taken off of the streets in our first gun buyback. As someone said, you know, you might get grandpa's gun, and I said, we'll take grandpa's gun so the grandsons or sons don't get them. It doesn't matter. To get those many guns off the streets of our city, I think is great. We'll see what happens today. I think the gun buyback continues today, so we're hopeful.
And then, real quick, your thoughts on the, I think it's now 5 people shot yesterday, it was broad daylight. You're talking about having more police officers on the street.
That's why it's important.
Right, yeah.
That's absolutely why it's important. People want to feel safe and protected in the city. While we've not had a homicide, you know, to me, gunshots could end up in somebody being dead. Gunshot could end up in crossfire and somebody else getting hurt. We've said put down the guns. This is unconscionable. It's not what we want for Baltimore. When we got all of these positive things going on, it makes it very difficult to elevate the conversation around, neighborhood investment fund, affordable housing trust fund, 10 new parks being developed in our city, pools being free in the summer. It's hard to elevate that conversation when these kinds of things are going on, so we continue to say, stop the violence. Thank you all.
Thank you.